what I've noticed is there is stigma everywhere. If we're introducing something to the population at such a large scale, we have to be ready for large scale consequences. Yes, this is a patch, not the cure. And so I think we have to be careful about that. We don't speak about that. We have patients that have this issue. We have to be very careful about the downstream effects it's going to have 10 years down the line.
Good morning. It is me and Dr. Sharma Raghav. Is that correct?
That's correct.
Awesome. Wonderful to have you here today. So we're going to talk a little bit about you and your profession as a cardiologist and the drug Ozempic that has been getting a lot of buzz lately. What I want to go over first is just share a bit about yourself, your background, where you grew up, and what led you to your profession.
So currently I live in Orlando, Florida. So I'm in Central Florida. Actually, I had the best childhood. I grew up between India and the Midwest and New York. So I would say I spent majority of my childhood in the Midwest and New York. Why I chose the profession, first of all, my parents were physicians. They are physicians. They moved here, first generation. We really struggled the American dream and, pulled up our bootstraps and got to work. And here I am, second generation physician. So, for me, it was a no-brainer. There was nothing like, the fulfillment and the gratitude and the kindness that you get to give to others by being a physician. I would say over 15 years of schooling and training after college later, here I am having a conversation with you.
Awesome. Well, thank you for having a conversation with me. So you have a lot of thoughts about this new drug that's on the market. Is that right? You must have encountered Ozempic or Wegovy often recently.
100%. I always take a pause whenever something grows so rapidly, right? So whenever something grows so virally, so rapidly, you have to take a pause and say, okay, if we're introducing something to the population at such a large scale, we have to be ready for large scale consequences. And that's what really got my attention. And that's what's really ignited a lot of the conversations that we've had in the medical community. And most recently, there's been some articles in the press saying that, hey, it's really good for heart health. And I think, for my patients, for our public, I think they have to have a real understanding of what that really means. In the 80s, they told you that drinking alcohol was really great for heart health, but it's out of context. So I think we need some clarification. I certainly think we need to start a conversation about it amongst medical professionals and healthcare professionals and our patients.
Are there side effects that you're seeing that might show it may not be good for heart health, or any other negative side effects that you're seeing in patients?
Majority of the side effects that you have with Ozempic, Wegovy are not actually cardiac related. Not that we know of yet, right? So now we will get some data. We always make sure that when we comment on things, we have some at least data to fall back on, whether it's 1 year, 5 year, 10 year, 20-year data. And as that data evolves, we have more and more insights that we can give you about a certain medication. So right now, we don't have that 5, 10-year data, especially from the cardiac perspective. But certainly there are some side effects from the non-cardiac perspective, whether it be pancreatitis and some what we call metabolic side effects. As far as the cardiac side effects go, there was some report of hypotension, which means low blood pressure and things like that. What we call a tertiary cause can be elevated heart rate for several reasons, right? But not specifically cardiac side effects that, I've noticed. I think overall my impression of the drug in patients that are obese, right, that have needed it, that are diabetic and obese, it's been positive, frankly, because, they have a tough time focusing on getting on to a dedicated diet and exercise program. And so this kind of helps to, kind of adjunct some of that.
Right.
To get them in the right track, and then they can start to focus on some of the habitual changes that they need to.
I see. And just so we're clear, I'm aware of the words Ozempic, Wegovy, semaglutide. Can you talk about the differences, or I believe one is a brand name and one is the actual drug. Do you know exactly which is which?
Yes. So semaglutide is a medication we've had around for a while. Semaglutide is the generic version of Wegovy and Ozempic.
Gotcha.
And it is one of two major what we call GLP-1 agonists that we use. And this is the one that's been most studied and most effective as opposed to the other one. So yeah, so semaglutide is the generic version, and then you have Ozempic, which has different formulations and different doses, and then Wegovy that also has different formulations and different doses.
I see. So Wegovy and Ozempic are different doses of semaglutide, correct?
Correct.
Gotcha.
Correct. Made by different pharma, etc. Yeah, absolutely.
I see. Can you tell me a little bit about what being obese does for your health or how that can influence other health factors? And is it such a huge problem that someone would want to use Wegovy or Ozempic?
Certainly. So when people are obese or even morbidly obese or even, start to edge above a category above that, you have to think about the heart as a pump. It is a pump and it's pumping blood to the rest of your body. So imagine a pump that fuels and gives water to a city. Now you take that city and you increase it above the capacity of that pump. And that pump is going to get outworked and is going to start to fail. That's kind of the concept with what happens when people are obese or morbidly obese. When you increase the amount of tissue your heart has to pump to, and not only pump to, you're pumping it to what we call adipose tissue, fat tissue. The heart has to now get blood all the way down to those microcapillaries of all that fat tissue and all that extra weight that you have on. Not only that, it has to perform enough of a pressure to get it back to the heart. And so you can imagine over time, you have high blood pressure that forms because the heart has to perform tremendous amount of pressure to push it all the way out to the test cells. And then what happens there is that pressure is then seen also by your brain, by your kidneys, by your other organs, right? And the heart itself. So like, if, for example, Garnell, if you go to the gym and you work out, which I'm sure you do, right? What happens? You have a stimulus and your muscles grow. They get big, right? And you look great in photos.
Hopefully.
So the same thing happens with the heart. So when the heart sees that big blood pressure, it also starts to expand and grow and thicken. Remember, you go get out of the gym and that stimulus goes away.
Right.
When our patients carry that weight around all day and the heart struggles 24/7, it eventually starts to fail. It eventually starts to then thin out and then go into what we call heart failure. And so, definitely I think our patients that are in that kind of critical range that we really need to bring their weight down, which will in turn reduce their blood pressure, get rid of or decrease hypertension, get rid of or decrease high cholesterol, and get rid of or even decrease diabetes. So there's major benefits from that. And those three things are the major cause of heart disease outside of smoking. So, I mean, I think I see a real value to it. However, even in those Ozempic trials, they coupled the medication with an exercise and lifestyle regimen, right? And so, yes, our practitioners, I think I see a lot of physicians putting patients on Ozempic and Wegovy. But I think it's important to have a conversation that alone is not the cure, right? That's a patch. The cure is what you're putting in your mouth 3-4 times a day. The cure is how much activity you're getting daily. And so I think we have to make sure that as physicians, we're supplementing that knowledge and that habit formation in their day-to-day life.
So just so I understand correctly, you cannot take Ozempic or Wegovy unless you're also in this program that focuses on what you're eating and your habits and maybe exercise. Is that correct?
So you can. You can take Wegovy. You can get it from all kinds of sources. You can take it. The thing is, it's more effective if you do. And the science behind it, when they studied it, right? So when they studied it in all these patients, they had that on board. They had the lifestyle on board. They had the diet changes on board. Now, I will say they did several studies with this. They did several step studies with this. And when they looked at it as opposed to just diet and exercise alone, Ozempic did have a better effect. So I think there is a role for it. However, I feel a lot of the patients, when they come in, they don't have that kind of wholesome outlook on it. That yes, this is a patch, not the cure, and we have to work on the cure, which is largely, like we discussed, habits, right? You're not diet. I don't like to use the word diet because diet is something that, we did to go on spring break, look great for like 2 weeks and then, go back to whatever. But, really lifestyle changes. So really getting that identity around, hey, I am this healthy individual with healthy habits. And when you go on Ozempic, you start to feel great. And then coupling that and relating that into your lifestyle with working out, exercise, activity, and also good eating habits. I think that is how we should be guiding our patients. Yeah.
Can you talk a little bit about what Ozempic and Wegovy are doing inside the body and why they're affecting weight?
So this is amazing, actually. So GLP-1, what it does is it actually makes your body more sensitive to insulin release. So diabetics, especially type 2 diabetics, have decreased insulin release, right? Or what we call insulin insensitive. So they're not using insulin like everyone else does, that non-diabetics are. So GLP-1 agonists, what they do is for any glucose that you have in the body that stimulates your cells, your insulin response goes up. So that's essentially what we're doing at that level, which is interesting because if you increase your muscle mass, right, you do the same. Your cells take up more glucose and have a more impactful response to insulin. Increase your muscle mass, increasing activity levels does very similar things.
When a person is losing a lot of weight very quickly, are there any harmful or potentially dangerous outcomes that they should be looking out for? Or is it smooth sailing from there? Once you're starting to lose your weight, health is improving tantamount to the weight you've lost?
I think it really ranges. It ranges from the extent of even cosmetic changes, right? So you have cosmetic changes, loose skin, things like that. You also have, which we see more with gastric bypass surgery, like really fast weight loss, right? Where the rest of your body doesn't have a chance to catch up. With Ozempic and all this stuff, you're also going to have some muscle loss. And so I think we have to be careful about that. We don't speak about that. Everyone's very concerned about fat loss, right? But muscle loss is also important, and I think that has to be highlighted a little bit. That hasn't been researched as much, that hasn't been discussed as much. But remember, you're apart from your organs, your musculoskeletal system is your major metabolic resource in your body, right? So that's what helps your metabolism. Imagine if you go on a medication, you drop a lot of muscle mass, and then you have to come off the medication. Well, your metabolic rate is going to be very different than where you were before. Gaining muscle mass later in life is different. That's a whole different discussion. So I think that's where we kind of come into, hey, we have this medication, but really, when we give it out to the general population at mass, we have to be very careful about the downstream effects it's going to have 10 years down the line, 20 years down the line.
What about any interactions? Do you know of any potentially dangerous interactions people should look out for? Or is Wegovy generally well tolerated with any other medications?
Ozempic, Wegovy, semaglutide, it does cause decreased peristalsis, okay? So what that is, it causes decreased stomach motility and gut motility, which probably is largely the reason people are losing weight, right? So you're feeling fuller faster and fuller longer because your stomach's full. It's not moving food as much,
Is
okay?
it literally shrinking your stomach or no?
I mean, shrinking your stomach, that's a whole different discussion and how that happens. I think it's a theoretical, metaphorical thing that we talk about, but what it's doing is it's slowing the transit of food through your stomach. You have to be careful when we're giving the population medications. A lot of medications that are sustained release medication. Let's say I give patients beta blockers for their heart health. One formula of it stays in your system for 24 hours. Now, it's absorbed at different points in your gut. And can Ozempic have a little bit of an effect on that? Probably. We haven't looked at it yet, but yeah, possibly. But that really, becomes more concerning when you have patients that need to be on blood thinners because it puts them at risk of stroke. If you're not absorbing that at the right time, are you having a window where you're not completely protected? I don't know. We don't have that information yet. But certainly, I become mindful of it as a cardiologist. The other thing I'll say is I think definitely you have to be careful with things like alcohol, especially with alcohol. When you have this decreased stomach motility, people may have an effect of alcohol sooner rather than later or delayed rather than earlier. So I think it varies. I'd be interested to see, what comes out of the literature from this.
Are you suggesting maybe that alcohol is more potent or has more of an impact on people using Wegovy?
I don't know. Alcohol has the same effect. It decreases stomach peristalsis, decreases stomach motility. And so now you have a drug that people are taking that once you inject it is in your system for a week. And then if you drink alcohol on top of it, the compounding effect there is going to be unique. It's going to be different than anything we've seen before. Certainly we have patients that have this issue. We have diabetics that have this issue as a result of diabetes. The entity is called gastroparesis. And that can be very lifestyle affecting. It can be devastating. Now, with Ozempic, it's not a permanent thing that we know of, but, similar effects.
That will wear off if you stop using the drug or if you stop drinking alcohol?
Both.
Oh, gotcha. Okay.
Yeah, I think if you stop using the drug, the idea is if you know once you're off of it, I think anyway that your stomach motility, your gut motility should go back to normal. And certainly, after with alcohol, given the half-life of alcohol, it should come out.
Can you talk a bit about how our knowledge about these drugs has changed or evolved over the past 2 years? Because obviously many more people are using it. And so have we learned anything new, or is there anything that has surprised you?
I think, one of the newest things that came out, because now everyone's getting interested. People are having tremendous weight loss. And, as cardiologists, we're certainly like, hey, this is great. Our patients are finally losing weight. We can start to really get them on that right track with a grain of salt, making sure that, they're doing the right things and the lab work and all the metabolic effects are within limits. There was, some recent data that came out looking at what we call heart failure with preserved ejection fraction. And there was some suggestion that Ozempic helps that. I think we have to be a little careful with that study. The definition of how we, even cardiologists, define heart failure with preserved ejection fraction, which is really what we're looking at, the relaxation of your heart as opposed to the contraction. That definition, there's a lot of heterogeneity in it. Okay, so we have a definition that we stick to by one society, and the way they looked at it in the study is not so clear.
Mhm.
So, I think what's been interesting is now that we have a lot of the population using it and wanting to use it, practitioners are starting to ask the right questions. And like me and you, Garnell, are having this discussion, right? So I think that's been the biggest thing that I've noticed. Certainly more patients are asking me about it. When we first started, when we are using now, we certainly have a better understanding of the side effects, the pancreatitis, nausea, vomiting that can happen from it, the peristalsis effect that can happen from it, what happens when you go off of it. That's starting to come out a little bit more. Now that we're seeing it at such a broad scale, we're going to get some good data from it. Yeah.
So my idea of heart failure prior to entering the health field was it's heart attack basically. And recently, of course, I've learned that they're completely different things. And can you tell me a little bit about what heart failure is, and is it curable? Is it fixable, or is it something that people don't recover from?
I think heart failure is a very dramatic term. I am very aware of the stigma of disease. And so I think heart failure is a very dramatic term. I think let's talk about it in terms of pump function. Okay, so heart, like I said, is a pump. It's an amazing pump. It's immaculate. A decrease in function of that pump means very different things and happens for very different reasons.
Mm-hmm.
Can you recover from it? Yes. There's certain injury patterns that can happen to your heart, whether it's lack of blood flow, which can be a heart attack, infection, stress, things like that some people can recover from with the right medication, awareness, catching it in the right time, seeing the right people. So some of it can be reversed. The data we have on that is from heart attack patients. Majority of those patients that had pump dysfunction on the right medications recovered. Some of them stayed the same, and some of them got worse. And this is something that we are very interested in the cardiac community. There's a lot of literature going on for that, both from medications, from mechanical devices, things like that. Essentially, think of heart failure as a pump dysfunction. Now, there's different causes that can cause that pump to decrease its function over time. And there's certain things that we can do, both medications and otherwise, to help recover and support some of that function. So it ranges, the treatment of it ranges from medications to transplant.
And what you're seeing is that Ozempic or Wegovy has shown to be beneficial for people experiencing heart failure. Is that correct?
Oh, so that's the key there. So I don't know. I'm honestly the jury. I feel that the jury's still out. That study, certainly, if you lose weight, your symptoms from heart failure go down. Not certainly, but that it seems to show that. And if you lose weight, your admissions to the hospital might go down. Curing it is a whole different issue because etiology, why you're having it, is a whole different issue. But if you imagine, if you have a pump, right, that pump that's pumping around to the city, and if you have that function decrease, and then you're like, hey, okay, I understand. Let me decrease the workload that you have to do. Pump function is going to do a little bit better, and you're going to feel better. And, that's probably what led to a lot of those findings.
So if a person is interested in Wegovy or Ozempic, but they just don't trust it yet, they don't feel like there has been enough time to study or go over data, are there alternative therapies to prescribe instead?
So I have patients that are on one end of the spectrum that I know they need to get on something quick, and we can start to decrease the weight, and I think it'll help their heart health in the near and long-term future. I think those are good candidates. The patients who are kind of on that borderline, where the blood work is on the borderline and are motivated, I usually start with some education. I start with education. So I never prescribe, hey, you need to walk this much, you need to lift this much, this is what you need to eat. I usually would prescribe, I will say, hey, can you go do some research about heart healthy diets? And I'll usually give them a base, being plant-based diets or Mediterranean lifestyle. So Mediterranean lifestyle, plant-based lifestyle are the two more prominent diets or lifestyles that have shown to decrease cardiovascular mortality. That is death by cardiovascular events or strokes and things like that. Because I really believe that once they start doing research into it, they become interested in it. Once they become interested in it, they ask the right questions, and then real change starts to happen. As far as medications, I myself, as a cardiologist, don't necessarily prescribe specific medications. There are other medications out there, and they have their own host of side effects and issues. Out of all of them, the one I'm seeing most prominently is this, and then some other diabetic medications as well.
Do factors such as blood pressure and high cholesterol or other conditions affect how Ozempic or Wegovy works, or is it the same across the board? Are there comorbidities? Is it comorbidities better?
Yeah, no, it is. Yeah, I mean, I would consider them. I mean, again, dramatic word. Yeah, it's those are in our world considered comorbidities. Would someone with high blood pressure, high cholesterol react to Ozempic or Wegovy differently? I don't necessarily know that clear answer. Let's say if you're on multiple blood pressure medications, right, and we're having a tough time controlling your cholesterol, if you lose weight on either drug, could we get you off some medications? Yeah, I think so. Generally, every 5 to 10 pounds you lose, we see a decrease in your blood pressure by 5 to 10 millimeters of mercury, right? And so if your blood pressure goal is 140/90, that means that if you get below that, we can start to get you off of medications. And once patients then say, hey, look, I'm starting to come off medications, and let me see if I can get off the Ozempic or Wegovy by lifestyle changes, I think that's when you start to have real change.
So are there any misconceptions that people have about Ozempic or Wegovy that you've seen that you'd like to clear up?
What I've noticed is there is stigma everywhere. Right? There's a stigma with disease, with diagnosis, comorbidities, right? You say something, people are like, hey, I don't have comorbidities. I can get rid of these. They get so I think there's a lot of that stuff. I think people have to give themselves a break. It's okay. No one's perfect. Everyone's trying to figure out the answer together. And the other thing is that one drug doesn't fit everything. And so I think people think that, hey, you know what? I don't have to do anything. There's a quick fix. Let me go get this drug and it's going to solve everything. It's not. Your eating habits have to change because those eating habits that you have reflect and trickle down to your family, and they're not on Wegovy or Ozempic, right? So one thing is give yourself a break. If you need help with weight loss with this, I think it's reasonable from the data that we have currently. And I think the stigma of, hey, I'm using this, but I don't want to broadcast it because I don't want people to think that I don't have what it takes to do the diet or the exercise. I think that has to kind of start to go away. It's okay. Life's tough. We're going to figure it out.
I meant to ask earlier, Ozempic usually is taken every day in a shot form that goes into your abdomen. Is that correct?
Weekly.
Weekly. Okay.
Yes. Yeah.
So thank you so much. Have a great rest of your day.
Appreciate it. You too.